Everyone, what's going on? This is Max from Unsubscribed Healthcare. I wanted to go over workflow. A couple of you guys have asked for just a generalized video of workflow, so here it is. Basically, inside of the PT Elite package, you have all these folders. Underneath the patients, this is where you're going to go for when you have a new patient folder automatically created. When you have a patient fill out the intake form or the subjective intake form, and then you have them click submit, you will see that it has created a folder automatically. I made a joke template or a joke intake form for Homer Simpson. I filled out all of his information. So when I come down here and I click submit, it will create a new folder. If you don't want to fill out all of the information right away, say you're busy and you're in the middle of treating somebody, you can take down their first name, last name, anything with the red, and then you'll be able to fill it in later. Obviously take down their phone number, but it's not required. The only other thing that's required is the patient ID that you create as well, so that way you can have the program recall all of the information. After you do that, click submit. We'll come over here, back to the patient's PT 2023. You can see Homer Simpson has been created. When I click on this, it'll be empty for a second, and then afterwards it's going to start to populate and create new templates. Basically, anything inside the template folder, it's going to copy and put their patient's name at the front, and then the SOAP note afterwards. The SOAP note is the one that I use the most. I generally don't use the other ones because I'm not specialized in pelvic health and stuff and all of the other templates that I've made. So when you first open it, when you go to document, you're going to click allow access. Once you do, it will say successfully connected. Everything should be filled in here. And then if we come over to the eval sheet, you're going to see that it is now ready to document. All of the information that I put in to the intake form has already been created and already been submitted. If I come over here, we want to click who is treating. When you click who's treating, it's going to pull up their NPI number and everything else automatically. After that, we're ready to start documenting. What we do is that we come over here, we fill all of this information. If the patient does fill out the subjective intake form, which is this, you can customize this one completely. The regular intake form you can't customize because that goes with the CMS 1500, but really if you don't like how this looks, you don't like these questions or how many options there are, by all means delete them. I put in extra so that you guys would be able to have it there and make it easier for you. Sometimes patients don't like this because there's a lot of options to go through and they read through every single option. Once you go to next, you can see that there's a HIPAA privacy notice. Click next, informed consent. By clicking this name and typing their name, they are agreeing and digitally signing. And again, cancellation policies, financial responsibility. So this is what your patients would fill out. I have a link for this on my own website. So when I have a new patient, they fill this out. And then once they click submit, all of that information should also populate. Okay, so we come back to the Homer Simpson, and now you can see that it started to populate. You can also, if you are skilled with Google Sheets, you can make it so that the program writes itself, basically. You can see not everything was filled out, so it's not going to write itself, but I do have a video on how to make it automatically start to program. But this is where you would write patient has a low back pain, that you can see the gills are, be pain free. That's what they put in the intake form. If we wanted to do outcome measures, we would come over here to the bottom of the tab, click on outcome measures. If it's low back pain, I'm going to start to, first I'll delete what's in there, and then I'm going to start typing low back or back disability. So whatever one you would want to use, right? Thought I had the especially. Okay, click search. So once you do that, it's going to ask you to authorize it. You click on advance. You only have to do this once per template, or once per patient. So after you do that, now you're going to click search again. Basically, that just allows the script that I've run to run correctly, and now you can see that it pulls all of that information forward. So If we wanted to just run through this, I'm just going to click on that. You can see that I've made it so it's color coded, so you can see that it's telling you visually if it's good or bad or how they're feeling. And then you can see it also automatically calculates the totals for you. So we come back to the eval sheet, and you can see now it has updated to modify Osprey Disability Index, and then 16 out of 50. So it gives you all of that. You'll be able to type in your objective information, posture, all of that stuff. When we come down to the bottom, we can also do flow sheet, update the plan of care. Again, I put in way more information than most people need. If you're cash based, you can, obviously modify this to fit your needs. Once you start to fill in flow sheet shortcuts, so say I'm going to do a flow sheet shortcut. So say we had him do lateral trunk rotations. Okay, 5-second holds, 10 reps, 3 sets. He spent about 5 minutes doing it, and we're going to call it therapeutic exercise. I'm going to move my recording, click submit. Okay. Now when we come here, you can see that it's been submitted, lateral trunk rotations, and it puts in all that information. So later on, I'll be able to just click that for any patient going forward. That's how you make shortcuts. You can see here, when I click on the date that I'm signing off as the therapist, it looks good. All right. So once I'm ready to save as PDF, I click Save as PDF. You can see the script is running. Then what it does is it creates the PDF. You can view the PDF that you just created. So say there is a typo or something that you missed. This is what the PDF looks like. If you don't like how it looks, you can modify it and change it. All right. Once we're ready to get out of that, we just close that window, close that window. If we go back to his PDFs, you can see now that the eval has been created. Okay, and so this is where you would find it is in the PDF folder. So anytime that you click on the PDF folder, it's going to have the PDFs here. Here is also the subjective and consent to treat. So it creates a PDF once they submit their consent to treat. You can change this around as well if you don't like the look of it, and you can make it however you want. If you do add more questions to that subjective and consent to treat, you will want to change this around. But yeah, so that would be the eval. Now, say they came in for their next treatment. If we come over here to the RX note, you're going to see that it has the blue, which means that that's the eval information carrying forward. So the blue eval information carrying forward I use for when I use it for a progress note. If you want to minimize it or get rid of it, you can click the minimize on the left, right? And we can choose which ones we want. The way that this works is that the bottom part and going up to the top part is what it's going to minimize. So this will minimize 58 through 53. And now you can see it's just current objective measurements. If I come over here, I can see the bottom of this line is at 73, and it goes up to 59, so it's going to do all the way through 60. And that's how you can minimize it and customize it. So if I want to just do a SOAP note, I'm going to collapse all group rows, and now you can see that it is just a SOAP note. So you get subjective, objective, assessment, and plan. Again, if I had filled all of this information out in the eval, it would carry forward. So you can see here the lateral trunk rotations did carry forward. It also will add the time for you down here for any of these CPT codes that you use. So if we were done documenting for their treatment, what I would do is I would do copy and name, and I would do RX1. You could put the date that you did it as well if you want to. It really is up to you. However you want to do it, you can do it. So usually I would just do RX1. When you click OK, it's going to create an exact copy of it. So I'm going to put my name down, and then I'm going to click Save as PDF. When I click Save as PDF, it's going to go again and run through that programming. And now I can click on it to review it. And this is what it would look like. So obviously I don't love how that looks, so I might go back and change it. You don't have to though, as it will print out just fine like this. It has all the information that you need. So we come back here, we go in PDFs, and now you can see that it saved it as Homer Simpson RX1 23/10/23, and it tells you the time that you saved it as well. So coming back here, say I need to do an addendum. I'm going to do copy and name on the first treatment because that's what I need to fix, right? So RX1 addendum, click on OK. And now I'll be able to document the addendum. So if there's anything that I need to change, after I'm done changing it, I click on Save as PDF, and you are all set to go. So that's a basic rundown of how you would document and how you would get started with the documentation after the patients create the PDFs. But you can see now it names it RX1 addendum. So yeah, I hope you guys enjoyed this video. I hope it was helpful. Feel free to leave comments below and let me know if there's anything else that you want to see. Thanks so much.